Hi, my name is Dolores Lane, and I am doing cognitive behavior therapy. How cognitive behavior therapy revive your thoughts. CBT aims to help you identify and explore the ways your emotions and thoughts can affect your actions. Once you notice these patterns, you can begin to learn and reframe your thoughts in a more positive and helpful way. The core concepts of CBT is largely based on the ideas that your thoughts, emotions, excuse me, and actions are connected, are connected in other words. The way you think and feel about something can affect what you do. If you're under a lot of stress at work, for example, you might see situations differently and make choices you wouldn't ordinarily make. But another key concept of CBT is that these thoughts and behavior patterns can be changed. The cycle of thoughts and behaviors. Here's a closer look at how thoughts and emotions can influence behaviors, for better or worse. First, inaccurate or negative perceptions or thoughts contribute to emotions, emotional distress, and mental health concerns. These thoughts and the results distress sometimes lead to unhelpful or harmful behaviors. Eventually, these thoughts and results behaviors can become a pattern that repeats itself. Learning how to address and change these patterns can help you to deal with problems as they arise, which can help reduce future distress. Popular techniques. So, how does one go about reworking these patterns? CBT involves the use of many techniques. Your therapist will work with you to find those that work best for you. The goal of these techniques is to replace unhelpful and self defeating thoughts with more encouraging and realistic ones. For example, I'll never have a lasting relationship might become none of my previous relationships have lasted very long. Reconsidering what I really need from a partner could help me find someone I'll be compatible with long term. There are some of the most popular techniques used in CBT. One of them is SMART goals. Goals that are specific, measurable, achievable, realistic, and time limited. Guided discovering and questioning. By questioning the assumptions you have about yourself or your current situation, your therapist can help you learn to challenge these and consider different viewpoints. Journaling. You might be asked to jot down negative beliefs that come up during the week and the positive ones you can replace them with. Self talk. Your therapist may ask what you tell yourself about a certain situation or experience and challenge you to replace negative or critical self talk with compassionate, constructive self talk. Cognitive restructuring. This involves looking at other cognitive distortions affecting your thoughts, such as black and white thinking, jumping to conclusions, and beginning to unravel them. Thought recording. In this technique, you'll come up with unbiased evidence supporting your negative belief and evidence against it. Positive activities. Scheduling a rewarding activity each day can help increase overall positivity and improve your mood. And situation exposure, which involves listening situations or things that cause distress in order of the level of distress they cause and slowly exposing yourself to these things until they lead to fewer negative feelings. Homework is also a part of CBT. This might involve more practice with skills you learn in therapy, such as replacing self criticism thoughts with self compassionate ones, or keeping track of unhelpful thoughts in a journal. What it can help you with. CBT helps with depression, substance abuse, eating disorder, PTSD, anxiety disorders, including panic and phobias. It also affects with OCD, schizophrenia, bipolar disorder, but you do not need specific mental illnesses to benefit from CBT. It can also help with relationship difficulties, breaking or divorce, health diagnoses such as cancer, grief for loss, chronic pain, self esteem, insomnia, and general life stressors. CBT is one of the most studied therapy approaches. In fact, many experts consider trusted sources it to be the best treatment available for the number of mental health conditions. In 2018, Review Trusted Source of 41 studies looking at CBT in the treatment of anxiety disorder, PTSD, and OCD found evidence to suggest that it could help improve symptoms in all of these issues. The approach was most effective, however, for OCD, anxiety, and stress. Research published in 2011 trusted sources suggest that CBT can not only help treat depression, but it may also help reduce the chances of relapse after treatment. It may also help improve symptoms of bipolar disorder when paired with medication. But more research is needed to help support those findings. In 2017, studies looking at 43 people with OCD found evidence to suggest brain function appeared to improve after CBT, particularly with regarding to resisting compulsions. In 2018, study trusted sources looking at 104 people found evidence to suggest CBT can also help improve cognitive function for people with major depression and PTSD. What to expect at your first appointment. CBT sessions tend to be very structured, but your first appointment may look a bit different. In general, you'll get more out of therapy when seeing a therapist. You can communicate and work well with. If someone doesn't feel right about one therapist, it's perfectly okay to see someone else. Not every therapist will be a good fit for you in your situation. Keep in mind that CBT can be incredibly helpful, but if you decide to try it, there are a few things to keep in mind. It is not a cure. Therapy can help improve issues you're experiencing, but it won't necessarily eliminate them. Mental health issues and emotional distress could persist even after therapy ends. The goal of CBT is to help you develop the skills to deal with difficulties on your own in the moment when they come up. Some people view the approach as training to provide their own therapy. Therapy can challenge you emotionally. It often helps you get better over time, but the process can be difficult. You'll need to talk about that things that might be painful or distressful. Don't worry if you cry during this session. That box of tissues is there for a reason. While CBT can be helpful with many people, it doesn't work for everyone. If you don't see any results after a few sessions, don't feel discouraged. Check in with your therapist. A good therapist can help you recognize when one approach isn't working. They can usually recommend other approaches that might help you. CBT usually lasts between 5 and 20 weeks, with one session each week in your first few sessions. You and your therapist will likely talk about how long therapy might last. It takes some time before you see results. If you do not feel better after a few sessions, you might worry therapy isn't working. But give it time and keep doing your homework and practicing your skills between sessions.